We have highlights from Asia Society's recent web event titled On the Frontline, India's Community Health Soldiers. The panel discussion saw experts discuss the role of community health workers and community participation in health systems for early detection, diagnosis, and treatment of coronavirus in India. Donning multiple roles, these healthcare workers act as intermediaries between public health officials and the community. The virtual event featured a dialogue on providing medical services to the most vulnerable areas and what is India doing in community health outreach in the world's second most populous nation. Here is the story.
So today, what we are trying to do is to talk about the community service program that India has in place in the cities and in areas.
When we look at the health system of the state, we generally think of hospitals. But health system, as you know, is much bigger than hospitals. And if you're not invested in those aspects, the health system resilience, which is a measure of how well a system responds to a shock and how the essential things are carried on, will get affected. So what you will see would be states that have invested in hospitals are certainly important, but areas like surveillance and so on, they will do better. When I look at the health systems and the resilience of health systems, there are two dimensions in which I think we need to look at these things. One is internal to the health system. The other one is external. Let's deal with the internal part. Internal is when, how good are your systems, how good is your surveillance, how good is your procurement, what's your HR capacity, infrastructure, and there are some other, not so tangible ideas like, morale of the force, of the workforce, the delegation of powers and so on. All this generally get revealed during such times. And I don't want to take names of states, but if you look at the way states have responded, you will see that these have influenced how they work things. But what's also important is that, and when you look at when the most important failure that I've seen is in the surveillance part, in terms of tracing and tracking and quarantining. I have argued that if states had done this, you would not have seen this kind of booming of the epidemic. Because look, we had our chances. We got 3 months notice. We had the other countries had shown how this is going to happen, and this virus was coming from a certain set of epicenters. And I believe the health systems of most states, I attribute that to the lack of public health awareness or public health focus. Since we knew the epicenter and since the virus was coming from a certain region, we had a golden opportunity that was, I'm sorry, but frittered away. The advantage Kerala had was that we'd been through this before, and people knew the danger that was there. But there's another very important thing that going forward we have to be careful about.